Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for this week. I'm honoured to be here on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. We'll have our report, our written report for the weekend case numbers, hospitalizations, other critical information. It will be with you before 3 o'clock today. And in addition, the surgery numbers, which typically we do on Tuesday, will be provided later in the week, the number of surgeries canceled. So you'll expect that later in the week, and those other numbers will come in our written report before 3 o'clock. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much and good afternoon. So today I'd like to provide the latest update on our ongoing COVID-19 public health response. For many months now, as I don't need to say, I think, as COVID-19 continues to circulate in our communities, I've been asking everyone to take steps to protect yourself and those around you. And those steps remain as relevant and as important as ever. As we learn more about this virus, we have adapted our approach, and with us, step by step, have been millions of people in British Columbia. We've seen now how interconnected we all are, that the choices we make affect not only our own health and well-being, but it affects the health and well-being of our communities, our families, and our province. And we're seeing that with the challenges that are faced in different parts of our province. The actions we take or choose not to take affect the children in our lives, affect our elders and seniors, our neighbours, our friends. And we know the numbers over this past weekend have been stable, but they are still very high. And that means that we've had, again, increasing impact on our hospitals and our critical care. With this in mind, I'd like to address the situation we are currently facing in BC's north. We have been closely monitoring the situation in the north, and my public health colleagues and I are very concerned with what we continue to see in many communities across the north. COVID-19 is spreading at a higher than average rate. People are becoming severely ill, even young people, mostly unvaccinated younger people, and hospitals are pushed to the limit across the north. This is directly related to the vaccination rates in the communities where people are living. Communities with lower rates of immunization have higher rates of spread. The illness and the risk for everybody goes up. To address this, we have already put in regional health orders and are actively working with the Northern Health, my colleagues, to determine what additional measures we may need to break the chains of transmission across many communities in the north. For everyone, and especially people in the northern BC communities, we need to get back to the basics, the things that we know prevent transmission of this virus that we transmit to the people we are closest to, our family, our friends, our loved ones, our communities. We need to determine if there's additional measures that we need to take as well, and we need to ensure we're using all of the layers of protection we have available. That means washing your hands regularly, staying home when you're unwell, wearing your mask, particularly when you're around other people who are more vulnerable and in indoor public spaces, keeping a safe distance from others, and also getting vaccinated. It is not too late to make a difference for your own health and to protect your healthcare system and your community. We are also looking at whether we need to use booster doses in certain communities as a way to manage some of the severe illness and the outbreaks that we are seeing. We know that private gatherings, ceremonies, funerals and celebrations are a source of transmission, and it's transmission not just within a community, but people going from community to community. So I also want to remind the organizers of these types of gatherings and faith leaders in particular to ensure that you are using the guidelines that we have in place to protect your congregations, that you're ensuring everybody wears a mask in the indoor spaces, that you are carefully considering how or if people are coming together with high risk in communities right now and making sure that you can provide those virtual and online options that support people, particularly people who are more susceptible to severe illness or death from COVID-19. During this time of high risk, we need to go back to those basics, those things that helped prevent transmission in our communities. And what I'm asking people to do is not new, but we know it works. And those communities that are impacted now, we are seeing the effects of the stress on our healthcare system in the north, and that means people being transferred for critical care, and we know how stressful that is on families to not be able to be with their loved one when they're in serious condition. My healthcare colleagues across this province are also stretched, and we are tired. It's been a long 20 months, and I don't need to say that to people in British Columbia. It is so hard for us to see a preventable illness now affecting people across the province. And that is because we need to get vaccination rates up to protect people from having severe illness. A number of things that we are doing right now. Today, the provincial health order, the provincial health officer order requiring COVID-19 immunization for all those working in long-term care and assisted living has come into effect. And a similar order will be in place for acute care and community care that will come into effect later this month, and that order will be posted later today. Together, these orders apply to healthcare workers in all settings and all workers in healthcare settings. It is very broad for the very reasons that we know that these are settings where transmission causes strain on the system if healthcare workers are infected, but also can mean transmission to those who are most vulnerable to severe illness. I want to thank all of the healthcare workers who, for your own reasons, may have delayed getting your vaccine, but have now taken this important step. It is not too late. Few know better than those working in long-term care and assisted living what the impact of COVID-19 has been on our seniors and elders, particularly those who live in long-term care. As our seniors advocate has highlighted, it is these people who have suffered the most, both from COVID itself, but also from the measures that we've had in place to try and protect people. And I am incredibly grateful that you are doing all you can to support them and keep them as safe as possible as we weather this next phase of the storm. It is also important to know that this is a measure that protects you as a healthcare worker and keeps you able to care for those who are more vulnerable. It protects our healthcare system, our families, and our communities. I recognize as well that our public health mandates have changed over time, and they will continue to do so as the pandemic evolves and changes. And just as we may increase or decrease public health measures to ensure our protections are in step with our risks, we also want to keep things as straightforward and as simple as possible. So recognizing that young people are now wearing masks from K to 12 in our school system, I'm adjusting our public mask mandate and requiring it for everyone 5 years of age and older to wear a mask in all indoor public spaces. And that will be posted in the updated order today. For youth, whether taking the school bus or the city bus, the rules are the same. And I just want to say how impressed I am. I continue to be amazed at the adaptability and the resilience of children across this province, and many of them have told me that that they know how to wear a mask now, and that it's something that they do to keep themselves safe, to keep their families safe, and I just want to say thank you. We are also, as you may have heard, readying our province to be able to provide COVID-19 vaccines to youth 5 to 11 years of age as soon as the vaccines are approved for use by Health Canada. And we have heard that at least the preliminary data package has been submitted to Health Canada, and we may have that important vaccine available to us as early November. So we continue to talk with school communities, families, and parents to ensure the process will be as seamless as possible for everyone and make sure that our logistics are all in place so that we can provide this vaccine as soon as it's available. In the meantime, parents can now pre-register your children in the same way that we have registered ourselves or older children over the past year and a half. Notification of eligibility to book an appointment will be provided as soon as these vaccines are approved for use by Health Canada, and we have a sense of when they're going to be available to us in the province. So we are continuing to do what we need to do to make sure we can roll out that program to protect younger children as soon as the vaccines are approved. I'm also very pleased to see more and more businesses across BC and across the country are bringing in vaccine requirements in their workplaces. And we know that this is something that will protect employees, will keep workplaces safe, and keep businesses functioning safely. So I encourage everyone to take this important step as well. The COVID-19 pandemic has evolved, and so have we. And we need to continue to evolve to deal with each new twist we are faced with. We will continue to be nimble in our approach and adjusting as needed as we continue to weather this storm together. Things have changed and will continue to change, and as many people may have heard, the U.S. has recently announced some changes to their upcoming requirements for travel to the U.S., and they have recognized AstraZeneca, which is an important step for, I know, many people in this province who receive that really important vaccine. I know they are also continuing to look at mix and match vaccines, as many countries around the world, the UK, France, Italy, ourselves, have used these important combinations. And the data that we presented here from BC and from across Canada shows how effective the mix and match combinations are. And I know our colleagues in the US Centers for Disease Control are looking at those data as well, and we expect to hear more about this important issue, which I know affects a number of people in British Columbia as well in the near future. I also want to make sure that you know that we are also looking at whether third doses or booster doses are needed for populations in British Columbia. As you know, we've provided a third dose to complete the series for people who are immune compromised, as well as starting a booster dose for residents of long-term care. We are looking at other populations, and we'll be gathering that data and looking at how we might roll those out in the future. I want to assure everybody that we have enough vaccine for everyone, whether it's for someone in long-term care, for a first dose for children, or if and when a booster dose will be needed. As I've said before, we will weather this storm by all of us continuing to do our part and supporting each other along the way. And I think right now, after this weekend, it is particularly important for us to thank healthcare workers across this province. It has been a long, hard road, and we know that you are showing up every day